So students, in previous class we already discussed about the Apgar scoring, and it is decided by the baby's Apgar score whether to ship the baby in the NICU, means NICU, or to the postnatal ward near to the mothers. And after this we do anthropometric examination of the newborn. So today I will begin with the anthropometric assessment or examination. Anthropometry word also comes from the Greek word. Anthro means the human and metros mean the measurement. So that anthropometry is like a measurement of the human body, and it is quantitative in nature because we can measure it in the number forms, so that's why it is a quantitative in nature. So why we are doing anthropometric measurement? Because through this we will calculate the nutrition requirements, assessment of the degree of malnutrition, or to monitor the growth of the child, and also to calculate the doses of the medicines. So here some parameters for assessing the baby, like weight, height, head circumference, chest, abdominal and mid-arm circumference. And before the anthropometry examinations, first we will do switch off the fans, windows, because to maintain the temperature of the babies. Why we are maintaining the temperature of the baby? Because we will remove all the clothes from the baby's body, and after that we will perform the hand washing before and after the touching of the baby, and place the baby on the top of the examination table. Place the baby on the weighing machine for the weight measurement, and after this weight measuring we will note the baby weight. And be remember, don't leave the baby whenever the baby is on weighing machine. And at birth baby's weight near about the 2.5 to 3.5 kg, and baby lose their weight 10% weight loss at the first week of the life, but he will regain weight at the 10 days from the birth, right? And next is height measurement. After checking the baby's weight, we will check the baby's height with the help of the infantometer, and after this we will note the height for the records. At birth baby's height is near about 50 centimeters, and if we are talking about the range of the height for the baby is at birth 45 to 55 centimeters is a normal range. And if you are talking at the 3-month, baby's height is 60 centimeter, and 9th month 70 centimeters, and the 1 year baby's height near about 75 centimeters. So when baby is growing, weight will increase at some particular age. And the next parameter is head circumference. For this we lying the baby in the supine position, and placing the tape measures behind the baby's head, and running across the baby's most prominent head part, which is slightly above the brow line. And the normal value of the head circumference is near about the normal range is 33 to 35 centimeters. And after the head circumference we will check the chest circumference of the baby, and baby is lying position in the same supine positions, and bring down the tape measures behind the baby's back. You can see in the image and you will get easily. And the run measuring tape across the baby chest, and it should be along with the nipple line, and the normal value of the chest circumference is 31 to 33 centimeters. And next is abdominal circumference. To measure the abdominal circumference with the baby lying in supine position, same as in chest circumference, and but here bring down the tape measures behind the baby's waistlines or umbilical line. You can see in the image, and and measures tape is run it across the abdominal line, and normal value of the abdominal circumference is 31 to 33 centimeters. And the last anthropometric examinations is parameters mid-arm circumference. And for the mid-arm circumference, its normal value is near about the 11 to 12 centimeters at the birth, So through the anthropometric examination or assessment, we will assess the nutrition status of the patients, and we will calculate the malnutrition degree, whether the patient is mild, moderate, or severe malnourished. And we can also check the growth charting of the patients, and through the anthropometric examinations we also know about the dose calculations. It will very helpful for assessing the baby through the anthropometric examination. Next is identifications data of the pediatric client. Why we are taking the identification data from the patients? If we want our patient is safe, then we will should the correct or accurate data from the patient. And if we are filling the correct data of the patients, then there is no chance of mishappening of any care or any giving medications or other healthcare services to the patient. If we will not take proper or correct information regarding the patient, then we will reflect the medications error, healthcare services error, or any others errors. So be alert while we are taking the identification data from the patient. So here some components of the identification data for the pediatric clients. We are discussing about the one by one point, right? So here first point is name of the child. First we will should ask the patient's full name with the correct spelling, and if the patient is newborn, then we have to know that the baby's mother's, then we can write the patient's name. For example, if the patient's mother's name is Rani, then here we can write the about the patient's name, that is baby of Rani. If the baby's mother's name is Kavita, then we can write here the baby of Kavita. Next is baby or master. We already discussed in the name of the child. Next, when baby is newborn and at that time there is no name to identify, then we can use the mother's name, like baby of Rani, baby of Kavita, baby of Rekha, like that, right? In some hospitals baby term is used for the female baby. If she has identified like the baby of baby Ria, baby Muskan, and master term used for the male baby only, right? Next is chronological age. Chronological age is a simple calculations for the evaluate the child's age. For example, if the master Rohan's date of birth is 1st July 2018, then we will measure it in days, month, or the year. And today's date, 10th August 2021, then we will get the baby's age is 3 years plus 1 month and 9 days old baby. That is the chronological age of the baby. We will compare from the today's date present date from the date of the birth, then we will get the chronological age of the baby. Next is developmental stage. First, so to know the how many stages of the development of the child, there are three broad stages of the development. First, early childhood. In this, child is from the birth to the 8 years, and the second stage is middle childhood. That means 8 to 12 years of the child come under the middle childhood stage, and the last development stage is adolescent, and the age from the 12 to 18 years come under this, right? Next is gender. If child patient is male, then we can denote the master or a boy, and if the patient is female, then denote the alphabet F. And you should know that color coding system. If the male child patient, then we can denote with the blue color, and if other side female baby is there, then we can denote with the pink color for the female child patient. Next is date of admissions. Whenever the child patients come to the hospital with their symptoms for the treatment, then we can enter the date of the admissions. Next is IP number. It's a numerical number for the patient who is admitted to a healthcare facilities or to receive the healthcare services. and full form the IP is a patient's inpatient number, so that means who is admitted in the hospital for taking the care. Next is ward. Ward is like a room or a session or a unit in the hospital, and of course there are many wards in the hospital for the child's patients, like pediatric ward, an ICU ward, neonatal intensive care unit, and PISU, pediatric intensive care unit, postnatal ward, OT, etc. For it's only for the pediatric patients. And the next is bed number. Bed number is also important aspects to identify the patient, right patient. Next is diagnosis or provisional diagnosis of the patient. It's like a process for identify the conditions or problems of the patients from the sign and symptoms of the patients by the examinations. Or we can see here it's like a act to recognize disease from the sign and symptoms of the patient. Next is doctor in charge. Here we will write the name of the doctor in charge in which the child's patient is taking treatment under which doctor, right? Next is informant. This is a very difficult or tricky task to take the history from the child's patients or their parents, because that time they are very anxious or very nervous on seeing the conditions of their child. And if child patient is able to give the details to the history taker, then we can write the primary source of the data. Otherwise we will count the secondary source of the data. Next is date of assessment. Here we will mention the same date when the patients we are assess the child's patient. Next is address with the contact number. Here we are write the full address of the patients with the parents contact number for any further emergency queries. Next is chief complaints on the admissions time. In this, doctor asks the child's or their relatives for presenting the problems for the child's on the time of admissions, and after that doctor write their statement in the conscience form, what the patient is saying. And while listening the problems by the doctors, he is also saying the activities of the child, and it will also help to the doctors to make the diagnosis of the patient. Next is present chief compliance. When we assess the patients after a few days of the admissions, we compare that the what was the problem at that time of admission, and today when we are assessing what problems patient is facing today. So through we can compare the evaluation for a patient is progressing or not. Next is socioeconomic status of the family. Through this the socioeconomic status, we get to know about the economical status of the child's parents and which family they belongs to, like poor, middle, or upper middle, or rich, like that. Also know their income status and their education background and all. Next is family health history. Here we will ask if any family members or friends have recently experienced similar symptoms which we are seeing in the child, and if such a conditions is being seen in the family, then automatically it will reflect the child. And next is family tree. Here you can see some drawing a family tree, or we can call it as a genogram. And you can see here how to denote a male persons or a female persons, and also how to denote a child patient. So this is a family tree structure. Next is past medical history. Here we will collect the previous medical history of the patients. Like for example, if a young child present with the delayed speech, then we will collect the details, birth as well as the development milestone, and it should be necessary for taking the past medical history regarding the development milestones, right? Next is present medical history. In the present medical history, if the child is currently taking any prescribed medications and over the counter remedies, then we will ask to their parents if he is taking or not. If he is taking, then we will note the medications name, their doses, frequency and form, and also route of the medications. What are the route of the medications patient is taking, right? Next is birth history. In the birth history of the patient, birth history tells us a lot of information for the patients, right? Also, in this we will collect all the informations. Why did the child have any other problems, and why he is taking any medications, and any previous birth history, is there any conditions will be occur, and that time of medications a patient is taking. First we will collect the prenatal history in the birth history, and in this prenatal history we will check the obstetrical problems like abnormal antenatal scanning, scans, test, any drugs complications during the pregnancy if mother is facing that time, right? Next, in the birth history we will collect the birth history of the patients, any complication during the childbirth, Apgar scoring, and crying, baby is crying or not, any resuscitations required or not that time, and also collect the informations regarding the development milestones and growth history of the child. And next is nutrition history. Through the nutritional history, we will detect the nutrition status of the child. If the baby is neonate, then we will assess the breastfeeding, and if after the 6th month, then we will also check the breastfeeding with the feeding diet. And if child is young, then we will ask to the some few questions to the patients regarding their diets. Have you worried about your weight or body shape? And we can ask, have you noticed any changes in your weight recently? And we can also ask to the patients, have you have been any on diet? This type of questions we will ask to the patients or their patients relatives. Then some clue will interval will get regarding the nutrition status of the patient. Here one tabulation form is there. You can see here, according to the BMI we can check the weight status of the patient, of the person. If BMI below the 18.5, then patient is go underweight, and in between 18.5 to 24.9, then person is normal weight. And if go behind 25 to 29.9, then patient is overweight. And if BMI in between 30 to 34.9, then obesity class 1. And if BMI is 35 to 39.9, obesity class 2nd. And if BMI above the 40, then patient come under the obesity class category 3. So in these equations, a person's height is 152 centimeters, and then for the BMI calculations we have to convert from the centimeters to meter. So 152 centimeter in 1.52 meters. And next you can see the weight of the persons, that is 60 kg. So you should know the formula of BMI, that is weight upon my height in square meter. So weight is 60 kg and height in meter square like 1.52 whole square. So then we will calculate here, then we will get the 25.96. so that means we can see here BMI 25, then patient that person's is overweight according to the BMI. So through this calculations we will determine the whether the persons or a child is well nourished or malnourished, means child come under overnourished or undernourished through these equations or through this formula. Next is immunizations history. For the immunization history from the parents, we will ask that is the child up to take with their immunization or vaccines. Ideally, this should be checked using the personal child's health records, and also identify any records or records for any missed vaccinations or any medications. If we can take the history from the patients or patients' relatives regarding the immunizations.